Until 2003, I was in complete control of my life. I had a great job at Mass General as an urgent care doc. I had a dream gig at WBZ as a television health reporter, a happy marriage, a new starter home in the suburbs, and I had a 1-year-old black and white cockapoo named Cosmo. Life was good. But I always wanted to be a mom, and while my husband and I hadn't really started trying to have kids, I was afraid that at the age of 33, I was getting a little long in the tooth and had better get on it. So being the type A control freak that I am, I immediately consulted a fertility doctor, just to make sure everything was okay. Now, just so you know, if you consult a fertility specialist, you'll end up on a fertility path of no return. So within weeks of my first appointment, I was taking pills, then I was giving myself shots and doing artificial insemination, and before I knew it, we were heading for IVF. Mally, that's what my husband calls me. Mally, don't you think this is premature? We hadn't even started trying to have a baby. And I think he was mainly upset that we had skipped over that seemingly fun part where couples have lots of sex to get things going. But I could not be dissuaded. We needed to keep going because my 34th birthday was right around the corner. Now, some of you probably know IVF is the pits. It's a lonely, painful journey that I wouldn't wish on my worst enemy. Not that I have enemies. But being a doctor, I had complete faith in science. I knew it would work. I just had to put in the time. What I didn't realize was that it could be humiliating. I mean, I was a public figure, a minor one, albeit, but someone whom people on occasion would recognize, and I certainly didn't want the world to know that I was struggling to get pregnant. So I snuck around at work, on airplanes, in restaurants, with little needles and vials to inject into my belly at the appointed times. I hid behind sunglasses and under a baseball cap in the clinic countless times, waiting to get an ultrasound or a blood test. I would cringe every time they called out my name for an appointment. Ms. Marshall or Mallika. Thank goodness most people can't pronounce my name. And then I was told time and time again that the 2-month process that I had just completed was a complete waste of time. The drugs, the blood tests, the ultrasounds, the waiting, all for naught. I started to actually feel bad for my fertility nurse. She was a lovely woman, gentle and kind, and certainly used to delivering bad news. But after 8 negative pregnancy tests, with all of the treatments that I had over many months, even she had a hard time leaving me those dreaded messages. Hi, Mallika. It's Susan. I'm sorry to tell you that the test is negative. I know you must be disappointed, but the team will go back to the drawing board and come up with a new regimen to try next time around. We'll be in touch. I still remember the sinking feeling I would get every time I listened to those messages, alone in my car after work, since I didn't want to listen to them during the day and risk messing up my mascara with tears. When I was asked to think of an example of compassion in healthcare, I immediately thought of the compassion I felt from that fertility nurse as I quickly transformed from a confident, take-charge, fearless physician to a desperate, insecure, and frightened patient. Throughout the horrid process, she gave me hope, she held my hand, she showed me respect, and in the end, she and the team made me a mom. I cry every time I get to this part. I never forget the day that Susan finally got to leave the following message on my voicemail. Mallika, you are pregnant. I think she was happier than I was, and I wanted to reach through the phone and hug her. In the end, Susan stood by me through 4 months of Clomid, 3 cycles of artificial insemination, and 7 rounds of IVF. It eventually took 7 rounds to have my 2 boys, and then of course my daughter just appeared spontaneously out of nowhere. Of course she did. Maybe my husband was right after all. All we needed was a little faith and a little more sex. But Susan will also hold a special place in my heart, and to this day I send her a Christmas card every year so she can see how my little embryos are growing up. And now I pay it forward. not by design, but because the experience I had as a patient has made me a much better doctor. I remember one awful afternoon when I had to go in for excuse me, gentlemen in the room, a vaginal ultrasound, one in which they have to place a large probe in your you-know-what to see how your eggs are developing. By this time, my first son was about 9 months old, and I had started the awful process again to try to have another child. I'm lying on the bed with the radiology tech asking me to spread my legs and relax, and I was balancing my infant son on my chest because he had been fussy in his stroller. I was trying to keep him quiet, cooing at him, singing to him, while the tech probed further and further into my nether regions. And then my sweet little boy had explosive diarrhea in his onesie. You know, the kind that goes out the diaper and up the back. And all I could think to myself was, it doesn't get any more humiliating than this. And suddenly I had a newfound appreciation for all of the young mothers who had come into our urgent care over the years with a GYN complaint with their kids in tow. And I remember how mad I would get at them, that they had brought their kids with them to the doctor. I can't do a pelvic exam with kids wandering all around the exam room. Can't you leave your kids with someone else? And now I realize, no, they can't. Here I am, gainfully employed with more help than most, and I couldn't find someone to watch my kid that day lying on an exam table with a probe in my, I can honestly say, having been a patient myself and having felt vulnerable and at the mercy of my doctors and nurses, I get it now. So the compassion I was given as a patient, I now give to my own patients. And I remind myself that no matter who you are, or how educated you are, or how informed you are, you will one day be that patient who is just looking for a little understanding and a lot of help, without attitude and without judgment. Thank you.